Hi, I'm Dr. Melanie Palm. I'm a board-certified dermatologist in San Diego, California, and I'm medical director of Art of Skin MD. And today we are going to be talking about Sculptra aesthetic and doing a proper patient consultation. So I have a lovely patient with me today. Her name is Julie. She's a 40-year-old, very active mom of 3. And she comes in today, and she's so good in her own words. I wanted to get an idea, Julie. We'd kind of shared a little bit beforehand. Tell me, what are some of the concerns you have coming into the office today?
Sure. So I think I notice the more I work out and the older I get, the more volume I lose in my face. And I don't feel like I have a full youthful look anymore, especially if I'm dieting or exercising frequently. Then I notice a lot of volume loss. And so I come in to learn about what you have to help me make a more youthful, full face.
And I think your concern is so common among a lot of the patients that we see, starting to notice aging changes in the face. And so we have different options. And so I often like to ask our patients, do you have a special event that you're trying to get ready for? Is there any big landmark? Do you have a timeline to things? And sort of what is your day-to-day like? I know that you work and you're interfacing with people as well.
Yeah. So I want to look natural. That's my biggest concern, is that I don't want to look as though I've had any work done. I want to look as though I'm healthy and well rested. So I don't necessarily have any big event. I just want to look the best that I can on a daily basis. The better I look, the more I feel, the better I feel about myself.
Good. So that's good feedback. And so I think, Julie, when we're trying to get a feel as a dermatologist or board certified plastic surgeon about how best to address some of our patients' needs, we'd like to get an idea what's going on in your life, sort of what are your time commitments, is there a special event in your life you're getting ready for, and then obviously what areas of concern you have. What you feel in your face is really a great feature, and areas that you feel like maybe are changing. And so what I kind of hear from you, and what I hear from a lot of patients that we end up doing Sculptra aesthetic with, which I want to talk to you a little bit about, is that they just notice aging changes to the face. I look a little bit more tired. Maybe I've lost a little bit of the structure, and I'm noticing some more wrinkles on the face. And I think those are some things that we can address with Sculptra aesthetic. Sculptra aesthetic, it's approved for nasolabial folds, shallow to deep, and other contour deficiencies in the lower half of the face where wrinkles are present. And it's a really interesting injectable because it helps to stimulate your own body to build collagen and be sort of the scaffolding and the structural network that helps some of these wrinkles and deep contour deficiencies. It's something that's not instant gratification, so I think that's really important for us to talk about. It's something you'll notice a little bit of an appreciable change if we end up doing that procedure today, but it takes time to evolve because it relies on your body's own ability to build collagen. So I usually tell patients it's about 3 to 6 months before we really notice a nice change. But because it's gradual, but yet pretty substantial, it has long-lasting effects. So we'll talk a little bit later on about sort of maintenance therapy, because I think it's important to know it's not just a one-and-done procedure. I want to have you as sort of a committed patient for a lifelong sort of relationship with healthy skin, and I think having maintenance therapy every once in a while, once we've achieved your aesthetic goals, is really important.
Okay.
So Julie, you had a little bit of an opportunity to discuss with me some of the changes you've noticed on your face, but I'd love for you to again reiterate a little bit some of the either aging changes or just changes you've noticed over time that you're a little bit unhappy with.
Sure. I think my 2 primary concerns is volume loss and an increase in wrinkles that I'm noticing, both volume loss and wrinkles around my nose, in my cheek area, and then around my chin. I noticed that I'm not as full and youthful looking as I once was. And if there was an option to kind of correct that in a very natural looking way, I'd really be open to that.
Yeah, that's great feedback. And I think that's a common area that women struggle with as we age over time. And we'll talk a little bit about how bony support, soft tissue support, and the skin all play a role in that aging process, and how we can help address some of these wrinkles over time with a collagen stimulating and sort of enhancement helper such as Sculptra aesthetic.
Great.
Any questions?
No, I don't think so.
Perfect.